Hi there. In this video, we are going to start third chapter of Robbins basic pathology. So this chapter is about inflammation and repair. In this chapter, we will study about inflammation, types of inflammation, acute inflammation, chronic inflammation, various inflammatory mediators, consequences of inflammation, and tissue damage and tissue repair. So let's start it. What is inflammation? So inflammation is basically a protective response of body against any damaging stimuli or any external particles such as bacteria, viruses, microbes, and it is basically needed to eliminate the offending agent. So inflammation is basically a protective mechanism. It is not a damaging mechanism, which is a commonly perceived concept. It is a protective mechanism against harmful agents. So whenever any harmful particle gains entry inside the body and tries to damage the body tissues, inflammatory reaction is started, and this inflammatory reaction eliminates that offending agent and then promotes tissue regeneration or repair process. So it is the inflammatory reaction. So typical inflammatory reaction develops through series of steps. So what are these steps? Offending agent, which is located in the extracellular tissue, is recognized by host cell and molecule. When it gains entry inside the body, it is recognized by cells present in tissue, and then they release various cytokines etc, and these cytokines activate leukocytes, and these leukocytes reach the point where the offending agent is present, and these leukocyte and complementary proteins work together to destroy and eliminate the offending substance. Then when the offending substance is removed, the reaction is controlled and terminated, and whatever damage has occurred to the tissue is repaired. If there is mild damage, it is repaired thoroughly, but if there has been extensive damage that cannot be repaired, then it is replaced by scarring or fibrosis. So inflammation is basically of two types. One is acute inflammation and one is chronic inflammation. So initial response to the damaging stimuli is called acute inflammation, and it develops rapidly within minutes and hours and is of short duration. So its main characteristics is edema and migration of leukocyte, and among leukocyte the dominant WBCs are neutrophils. So acute inflammation is dominated by neutrophil, while in chronic inflammation the dominance is of lymphocytes. So this inflammation, this initial response tries to eliminate the offending agent, but if it fails to eliminate the offending agent, then there is chronic inflammation. So next we see here, this is a diagram. If we see this is the skin tissue, and this is the microbe which is entering here, and this is extracellular matrix or tissue matrix, and in this space macrophages, dendritic tissues and mast cells are present, and these are basically cells which are recognizing the antigen. Here they have receptors to recognize these microbes or foreign antigens, and when they recognize them, what they do, they release several cytokines and inflammatory mediators. So these are the various mediators. Inflammatory mediators are the chemical substances which induce inflammation. So microbe entered here, or these are necrotic tissue where their products reach there, and these tissue macrophages, dendritic cell and mast cells recognize them. After recognizing them, they release inflammatory mediators, and these inflammatory mediators acted upon blood vessels to cause vascular dilation, as well as they recruited neutrophils and monocytes to the site where these damaging microbes and necrotic cells were present. They leave the blood vessels, and then they eliminate these microbes or dead tissue, and when they are eliminated, macrophages stimulate the cellular repair process. So it is a typical picture of the inflammatory reaction. So if inflammation is not controlled, there is inflammation becomes chronic. It can ultimately lead to the fibrosis of the body organs and body tissues. So inflammation is induced by chemical mediators that are responsible by host cell in response to injurious stimuli, which we have seen here, and all these same details are written here in this text. So inflammation is manifested in the form of its cardinal signs. What are cardinal signs of inflammation? there will be heat. If you see an inflammatory part of the body, inflamed part of the body, you will notice that its temperature is higher as compared to the surrounding tissue. There can be redness of the inflamed tissue, and there will be swelling obviously, and pain may also be present there, and there may be loss of functionality of the tissue. So these are the common cardinal signs of the inflammation. So inflammation can be a response to dead tissue, it can be a response to foreign particles, and it can be an abnormal immune response. For example, in allergies, immune system starts damaging its own body tissue in response to some harmless external antigen. It can be autoimmune diseases in which body immune response gets directed to damage body own tissues. So it can be an abnormal immune response too. And in certain diseases such as type 2 diabetes, Alzheimer's disease, cancer, these diseases also cause background level of inflammation, some mild consistent background level of inflammation. So inflammation is as caused by inflammatory mediators. So anti-inflammatory drugs are developed which target specific inflammatory mediators to tackle this inflammatory burden on the body. So inflammation, excessive inflammation, it causes damage to the body tissues, and if it is not controlled, it can lead to fibrosis. In the same way, if there is little inflammation or inflammatory reaction is not going properly or not up to the mark, it can also prove harmful, as bacterial infection will not be eliminated from the body, and when bacterial infection will not be eliminated into the body, infection will persist and continue to damage, and bacteria will continue to survive inside the body. Here are some differences between acute and chronic inflammation. We will understand them betterly when we have studied them thoroughly. So acute inflammation is fast, chronic inflammation is slow and cellular infiltrate. In acute inflammation, neutrophils predominate. In chronic inflammation, macrophages and lymphocytes predominate. Tissue injury in acute inflammation is mild and self-limited, and chronic inflammation, acute injury can be severe and progressive, and local systemic signs in acute inflammation, they are prominent, while in chronic inflammation they are less. What are these systemic signs? These systemic signs include fevers, C-reactive protein, etc. So these are more prominent in more prominent in acute inflammation and less prominent in chronic inflammation. And here are some examples of inflammation, such as acute inflammation is involved in acute respiratory distress syndrome, asthma, glomerulonephritis, septic shock. And in acute respiratory distress syndrome, cells that predominate and that cause inflammatory reaction are neutrophil. In asthma, eosinophils and IgE antibodies. In glomerulonephritis, these are antibodies and complement proteins, neutrophils and monocytes. In septic shock, cytokine. In septic shock, there is a cytokine storm that causes various complications, which we study in upcoming chapter. And chronic inflammation involves arthritis, rheumatoid arthritis, asthma. Asthma can be acute or chronic, atherosclerosis and pulmonary fibrosis. So these are different conditions which involve acute as well as acute and chronic inflammation. So next, what are the causes of inflammation? All those causes which can trigger cellular necrosis and cellular damage can cause inflammation. So these can be infection. Infection can be due to bacteria, virus, fungus, parasites, and they can induce mild as well as life-threatening inflammation. It depends on type of microbe and its duration of survival inside the body. Tissue necrosis can also trigger the inflammation, and various foreign bodies such as sutures, dirt, splinters, if trapped in the body tissues, they also induce the inflammatory reactions. Immune reaction, hypersensitivity, autoimmune diseases, these all can induce inflammatory reaction. So how microbes are recognized inside the body? See, these microbes are recognized by phagocytes such as macrophages, dendritic cell, as we have seen in this picture here. So these cells, phagocyte and dendritic cells, they have specific receptors to detect pathogen on their surfaces. These receptors are called tool-like receptors, and they're named so because the gene which codes them is tool gene. This gene is named as tool. So they are located in plasma membrane as well as in endosomes. Endosomes are basically cytoplasmic organelle which are involved in transport of lipid and proteins, especially in endocytic pathway and excretory pathway of the cell. So when cell endocytosis undergoes endocytosis, these endosomes play their role in that pathway. So these receptors detect specific bacterial components, specific bacterial structures, and these structures are called pathogen-associated molecular patterns, and then they lead to the transcription of various cytokines. These cytokines can be inflammatory cytokines, antiviral cytokines, and membrane proteins that can activate lymphocytes, and so on. Ultimately, they induce inflammation. Here is a more better picture of these receptors. This is extracellular space, and this is a tool-like receptor, and this is bacterial product which is being recognized here. And this is endosome, which is intracellular organelle, and this is tool-like receptor, which is recognizing nucleic acids of the ingested microbes. So extracellular, this tool-like receptor which is present on membrane basically identifies lipids of the bacteria, while which are present in endosome, they basically detect nucleic acids. As here also written here, in plasma membrane, tool-like receptor identify bacterial products such as lipopolysaccharides, while endosomal tool-like receptor recognize viral and bacterial DNA and RNA and DNA. So these were tool-like receptor. Next, intracellular surface of cell also have certain cytosolic receptors, and these cytosolic receptors detect certain molecules which are produced in under condition of cellular damage, and these molecules are called damage associated molecular patterns, and which involve uric acid. When DNA is damaged or digested, it can lead to production of uric acid, and this uric acid is a sign of cellular damage which is detected by cytosolic receptors. ATP in cytosol can also be a sign of cellular damage detected by cellular cytosolic receptors, and reduced cellular potassium concentration is a sign of plasma membrane damage. Moreover, DNA in cytoplasm in eukaryotic cell can also be a sign of cellular damage, because DNA is normally present inside the nucleus or in the mitochondria. So these damage associated molecular receptor, damage sensing receptor inside the cell activate a multiprotein complex which is called inflammasome, and this inflammasome leads to the production of interleukin 1, and this interleukin 1 is a cytokine which recruits the leukocyte and leads to the inflammation. So if this inflammasome gains mutation, gain of function mutation, or mutation that increases its functionality, it can lead to the inflammatory disorders, autoinflammatory disorders, because it is producing interleukin 1. If it gets mutated and continues to produce interleukin 1, then there will be continuous inflammation. So if there is autoinflammatory disease due to interleukin 1 mutation in inflammasome leading to increased production of interleukin 1, then the drug of choice is that interleukin 1 antagonists. Further receptors which are recognizing the bacterial products are certain circulating proteins, which include the complement system protein, for example C3b, which we will study next on, and there are certain mannose binding proteins and colectins. These are protein detect bacterial structures and can activate inflammation. So these are the simple things how bacteria are detected and how inflammatory pathways triggered. Next we will study acute inflammation in detail. Thank you.